Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos, and if you're new to us, welcome. It's great to have you here. We're having just some really interesting, curious conversations with real leaders that are painstakingly reshaping the future of healthcare. And we're pretty passionate about a few different areas. We're passionate about leadership, about innovation adoption, we're passionate about access. And if it's your first time tuning in, let me just take a quick step back and give you a little bit more about what we are trying to get done here. So, our focus is on bringing real stories of leadership and innovation within our space to life. And the goal and the objective is to honestly just highlight real people that are just getting stuff done, not stuff that you read in a book, but real things that are happening on the front lines and giving the guests the opportunity to share their story with our community through our platform and ultimately share their story with the world. So we've got an amazing action-packed year. If you haven't checked out any of the historical interviews, however you're watching this, if you're listening to it, please hit the subscribe button now so that any of the new episodes come directly to you. So one of the things that I guess I've learned after having now more than, I don't know how many episodes we're at, like north of 170 episodes, I've had hundreds upon hundreds of conversations with leaders across healthcare. It's kind of this. It's that the people that are doing the most interesting work um, rarely started their careers thinking that they would be operators. They started as clinicians. They wanted to take care of patients. And then somewhere along the way, they realized something important that if you want to improve healthcare, you eventually have to step into the system itself. And today's guest understands this reality like really, really well. So today's guest is Dr. Shannon Henning. She is the Chief Operating Officer at Hello Pediatrics. She is a physician who has stepped into the operational side of healthcare to really kind of help rethink how families actually access care for their kiddos. And if you're a parent, you know exactly what this moment feels like. Your child wakes up sick in the middle of the night, maybe it's a fever or a cough, and something just doesn't feel right. And you're standing there and it's like 2 in the morning and you're trying to make a decision. Do I wait until the morning? Do I go to urgent care? Do we go to the emergency department? So healthcare, we talk a lot about access, but I think those are the moments where access really, really matters. So, what Shannon and her team at Hello Pediatrics are building is actually different. It's different because it meets families in that moment. So, bringing pediatric expertise directly to parents, when they need it the most, instead of forcing them to navigate a system that often feels confusing and slow, whether you have been in it for a while or not I mean, it's confusing. So I think what makes Shannon unique, it's her perspective. She's done things from the clinical side. She's now seeing it on the operational side. And now she's helping build a model that kind of brings both of those things together and bridges both those things. So today, my focus is going to be for us to talk about the realities of pediatric care because I think it's something that really hasn't gotten a lot of attention. At least we haven't done a ton of episodes on the show, and I want to give it more of a proper focus. I think what it looks like when physicians step into leadership roles, and I think why solving access for kiddos may end up teaching us a lot about how the rest of healthcare needs to really evolve. So, Shannon, great to see you. Welcome to the show.
Thank you so much. It's so great to be here.
Wonderful. All right, so before we get into Hello Pediatrics. I kind of just want to start with a very simple question. I think
Sure.
when people hear chief operating officer, maybe they picture spreadsheets or dashboards and like all different types of meetings. But you started as a physician. So if we went back to the first week of like your clinical training, what do you remember feeling walking into the hospital for the first time?
I remember walking out of my house and thinking the entire 20-minute drive to the residency program I joined, I'm a medical student plus 1 day, and they're going to expect me to know how to take care of a patient. Imposter syndrome went to the 100th degree. It was exciting. It was nerve-wracking. I got into a car accident on the way home for my first day of residency. It was perfect. But I was ready. I was that really young, really animated doctor who just wanted to make kids smile and wanted to focus on the idea that in general, children are pretty resilient. They can get really sick or
Yeah.
really injured,
Hmm.
and we can easily fix them. And that was
Mm,
really simple to do in the residency aspect because I was in a hospital with all the care right there,
mm.
or in our ambulatory clinic that was connected to that hospital or those specialists. So that access you talk about was there at our fingertips 24/7.
Right.
Um, it was great. I learned so much, but I almost learned so much in this little bubble of all that access is right there. And then you step out of that role once you become an attending. I did work in the ER for a few years, so
Yeah.
still in that bubble. But then I went for my lion's share of my career into urgent care, which is different, a little less different. It's the
Mm,
same thing of being able to assess patients and determine that they're sick or they're injured, but not necessarily having access to the CAT scan or the specialist or all
right.
the things that you have in an ER. So it was kind of like that dwindled down access, if you will. And
Yeah.
I didn't have access to their medical home record. So I'm taking what they're
Mm,
telling me at face value. I did that for years and it was great. But you start to see the cracks in access and care when you are working in that world. And then I transitioned to general pediatrics where I saw even more cracks in care. General pediatricians are open when kids are in school and parents are working, and they're generally closed when kids are out of school and parents are out of work. And
mm.
you're a parent, kids get sick at 6 o'clock, 9 o'clock, not 2 in the afternoon. They
Yeah, the
get sick in the
most
most
inconvenient
in
time. You're like, oh my
yes,
gosh. Like, how come you don't get
exactly.
sick during, 8 to 5? Come on. Come on,
Nope,
kid.
never. And so, exactly what you said at the beginning, you wake up to at 10 p.m., wake up of a child who's got a fever, is group coughing, is screaming from ear pain. And what do? We used to, years ago, just call the pediatrician and they would advise over the phone. And many pediatricians still do that. But what kind of work life balance is that for your pediatrician who you want to be at top balance of sleep and self care the next day to take care of your child? Or urgent cares, which came around, 20 years ago, and you could pop over there, but they close at midnight.
Right.
ERs where you can get exposed to a million things, spend a ton of money, and or be treated by an adult doctor who doesn't know how to take care of kids. Their kids are not little adults. And so you're kind of in that in between. And that was the true gap in care noted by Dr. Sandy Chung, who started
Mm.
Hello Pediatrics.
Is-
It's
So
wild.
you're so you're running this company and
Yeah.
you guys are rethinking pediatric access. I'm just thinking, growing up, did you ever imagine that you would end up operating a healthcare company?
No,
Or was just the plan always medicine?
the plan was always medicine. I was 7, I think, when I told my parents I wanted to be a doctor, and it never changed. Not through the
So
opportunities to
so what kind of
compete.
kid were you?
Oh, I was the kid who took a book to my prom. Yep, it's okay. You can laugh. It's totally fine.
It's
I was
it's
that
not laughing,
kid.
it's fascinating.
I was the kid
Either that
who
or your date
loved.
was really boring.
No, he was great. I loved school. I loved learning, but I also have so many pictures of my childhood with me in fake stethoscopes and then real stethoscopes, examining my stuffed animals, my siblings, my cats who, I'm not a vet, but hey, they're like little babies, right? I can pretend. Um, I definitely went to college with the intent to go to med school, definitely finished school a lot younger than expected and got a master's in between. But medicine was always the goal. Pediatrics,
Mm,
not necessarily. That found me. I didn't find it.
yeah. Interesting because pediatric medicine is very it's unique because you're not just treating the kiddo, you're
Yeah.
often treating the parents' anxiety and their stressors. I guess what's something about um pediatric care that most healthcare leaders who don't practice medicine completely misunderstand?
Exactly what you just said. Many people think we're just treating rainbows and stickers. And while kids are resilient and they bounce back very easily, they decompensate really easily too. I
Mm,
was that connection with parents actually drew me closer into pediatrics than anything else.
yeah.
Caring for patients that were really sick and getting to know their parents, their siblings, their friends as they visited them in the ICU or wherever they were, and seeing not only was my impact on the patient also impacting their family and their lives. I'm an osteopathic physician. We like to look at everything from a holistic view.
Yeah.
And instead of just treating the patient, everything you're doing for that patient is also treating their family and their friends and their future. It's
Mm.
really, it keeps you going for sure.
I think yeah, every friend of mine that is a physician, they generally have like a patient or moment that sticks with them, something that they don't forget. Is there a moment from your clinical years that you kind of still sits with you?
Yeah, I have the names of 7 children that I can still remember till this day, all of their cases affecting me. I would say the one that most affected me was a little boy who had fallen into a pool in a backyard at a family party, didn't know how to swim, and his 18-year-old cousin just the day before had taken a BLS class to be a lifeguard. Noted that the little boy had fallen in the pool, pulled him out, and did CPR. This little boy was brought in as blue as a blueberry and unresponsive, and walked out of our ICU 8 days later, fist pumping and singing to everybody, perfectly fine. And it was definitely known that because that cousin took the class and was aware and helped
Wow.
until people could come, that was the defining moment of ensuring that child was going to be okay. That immediate response changed every course for that child. And he was so cute walking out. It was like nothing ever happened.
Wow.
Yeah.
Amazing story. It's incredible. Let's um let's talk about parents for a second. What's
Parents,
like the most common thing that, worried parents do that actually makes pediatricians smile a little bit?
they Google everything. We're competing against Dr. Google. Now we compete against ChatGPT and AI,
Yeah.
and it's fine. Um, yeah, they Google everything, and you can look at that as they're trying to work against you, or you can look at that as they're trying to educate themselves, and you want to work with
Hmm.
them to figure out that answer. Parents are going to come in knowing their
Interesting.
children much better than you do. I would say that one of the hardest lessons to learn as a pediatrician is to trust the gut of a parent. Even though you have the medical training, they have the parent training. I learned that both on the parent side and the pediatrician side, parent side with my own daughter.
Interesting. So, I mean, most physicians, right? They just sort of stay the track. They stay in clinical practice, and you moved on to the operational side of the house. What changed for you?
I started the operational side actually right after I had my daughter. I was working with Pediatrics, and they were starting to dabble in telemedicine. The first telemedicine machine they brought in was as tall and as wide as I am at 5'2". And we started playing around with it, ironically, about a year before the pandemic hit. And we really were diving deep into creating a telemedicine platform to support after hours. And just as that pandemic was hitting, it was, hey, you know what we're using this for? Let's pull you from clinical. Let's teach
Hmm.
everybody how to do it. Let's try and keep those doors open. And so I
Right.
got pulled to the operational side there, and I loved it. I loved being able
Mm,
to help PM keep their doors open and keep everything moving, really educate those providers on the best way to manage patients. And even through the pandemic, they used it. Post pandemic, they're still using it. And it was really great to see both sides, right? The clinical
yeah.
effects and the financial effects for the company to ensure they were doing okay. I did go back to a lot of clinical work after that, kind of split my time between. And
Hmm.
then when Hello Pediatrics needed someone to come in and kind of do similar work to that, I came on initially as a contracting basis. And a couple of weeks in, they needed work. They have bare bones staff. So I came on full time and it was great. And working through the protocols and having been able to see the clinical side and the operational side at PM really allowed me to pivot, tailor, and optimize their protocols to tailor to what they were trying to fix, that root
Mm,
issue.
mm,
Um, Never thought I would be doing spreadsheets or any kind of presentations or decks or marketing or business development. when I was 7, but definitely by the time I had a child and I was back in the workforce, I could see it happening. It's been a great experience.
You feel like aspects of being on the operational side of the house are kind of like different rotations like you did in your residency. You're like, oh, I'm doing this now. Now I'm doing this. Like, how do you
Yeah.
does that ever feel
Yes. For
okay.
sure. Yeah. So, when we first started, it was let's stand it up. Let's make sure we can
Mm.
just run. Even if it's not perfect, let's see if we can run. And then you start running and you go, ooh, that doesn't work as great as it should. Let's fix this. Okay, we fixed that. Now, could this be optimized? Yeah. Okay. Now we want to grow. We have to strategically make this expand. How do we do
Yeah.
that?
Mm.
Okay, now there's legalities behind it, and now there's protocols behind it, and now there's hiring behind it, and there's so many layers. And just as you feel like you're thinking, okay, we're good, do we want to have any work left to do for something else comes along,
Of
and then more
course.
projects come along. And it's just grown. It's been
Well, why do you think that um, more physicians don't step into like operational roles?
I think to some degree, at least in the generation of doctors I grew up in, it was be a workhorse, stay
Hmm.
on the patient side. That's where you're needed. And truth be told, things have evolved, and we need physician leaders to run these
Hmm.
companies. You don't want business leaders who don't understand the clinical side leading these companies. You
Mm.
can, right? You can partner with those business leaders for sure to ensure finances are going well, business development's going well, but you need clinical leaders to make sure you're compliant medically, you're billing the best you can, you're coding the best you can, your providers are doing what they need to do without being burned out, or else you're going to just have turnover and you're going to be working just as hard to retrain a new workforce.
Yeah.
Um, and I think that I definitely know when I was in medical school and residency, it was stay to clinical side. You'll never, never, never not have a job if you stay the clinical side. And that's true, right? We need clinical doctors, but I think the pandemic, for as terrible as it was, opened a lot of doors for people to see where clinical leaders were needed.
Mm. Let's shift gears. Let's talk more about Hello Pediatrics. So for someone who's listening that I guess has never heard of it before, how would you describe it to a worried parent in about 30 seconds?
Sure. We're just a great company that is an after hours partner to pediatric practices and their clinicians. Ideally, we are partnering with pediatricians, both
Hmm.
small practices all the way up to hospital systems, to provide after hours pediatric triage to help a parent decide, do they go to an ER? Do they have to go to that ER? Do
Hmm.
they have to go to that urgent care? Can they wait to see their PCP? What can they do overnight to help that patient that just woke up at 10 in the morning, at 10 at night? We provide telemedicine for patients who kind of fall in between the don't need an ER but can't wait to see their doctor, and
Yeah.
really provide that wraparound service for their pediatrician, which decreases the cost to the parent. It decreases exposure and wait time in an ER, but it ensures that that care is all kept in the medical home. So acute care follow-up is done with their pediatrician. All of that documentation goes back. The doctor's never going to wonder what happened with their patient overnight.
Right.
It's really a full communication system with treating
Does
that patient.
does the parent go directly to Hello Pediatrics, or do they initially go to their pediatrician, which then gets triaged and kind of the baton gets passed to Hello Pediatrics? Like, how does
Yeah,
that work?
the majority of the practices we're partnered with, patient behavior stays the same. You call your pediatrician if they're open, they're caring for you, and if they're closed, we're caring for you. We're just their after hours partner. So calling the practice means you're being rerouted to our doctors and nurses that are triaging you based on protocols set by us in collaboration with
Hmm.
the pediatrician. And
Hmm.
that allows that care to be seamless. The patients don't have to memorize 800 different numbers or go to different
Yeah.
websites. They can just call their pediatric home.
Hmm. Are physicians, practices that hear this, I mean, are they skeptical at first? Do they know that this is like a big issue? I'm just trying to think about this from how
No, that's a
quick
great
are they to want to
question.
make a shift?
Yeah, that's a great question. So I do think there's an innate question of after hour services. Are we going to take revenue from the practices? Are we going to take attribution? And the answer is no and no to both of those. We're not
Hmm.
looking to take revenue from practices. We don't take attribution. We're removing patients from ERs and urgent cares. We're not removing patients from their private practice. We truly
Hmm.
do work in collaboration to ensure we're not seeing patients when the practices are open, and we're not seeing patients that should be in the office, not
Right.
empirically or prophylactically treating anything. If that ear needs to be looked at, those lungs need to be listened to, that test needs to be done, we're telling that patient how to manage symptoms overnight, and then we're sending them to the office the next day for that evaluation. And we're closing gaps in care with well child visit checks, hunger vital checks, even vaccine checks to ensure that all of that is communicated back. I do think that there is minor skepticism. And then we get on the phone and we work through the workflows that
Right.
we're taking the hours of operation of your practice,
Yeah.
we're putting it into our system. We know that we're not going to see your patients during those hours. And once they hear all of that and they go live and they take a breath and they see we're very cost effective for them, we are doing exactly what they need us to do after hours without taking revenue from them, and they have work life balance returned. It's a huge win. All the practices that have joined us from the beginning have not left us, not a single one.
100% retention. That's amazing.
Mhm.
Has there been anything that's really surprised you the most, as you've started to really sort of scale and build this out?
Honestly, I think there was a part of me, having come from General Pediatrics, that was a little
Hmm.
skeptical that practices would be so open to joining. We've partnered with large hospital systems, Children's National,
Yeah.
PHKD, filling areas where they just don't have the bandwidth right now. They don't have the time or the resources to do this for themselves. And partnering with us has allowed them to take the breath. Just the reception has been beautiful for sure.
That is pretty cool.
Yeah.
So I want to shift gears for a second. I guess if I was to sort of magically place you as the chief pediatrics officer for the United States, we're going to drop you in there tomorrow. And what's the first thing that you change?
The distrust of pediatricians that I'm noticing across the country right now is hard. It's very hard. It's hard to hear parents questioning, but it's almost understandable. There's so much information out there that parents are trying to digest. So much information of, do we vaccinate? Do we not? What's harmful?
Mm,
What's not? Is Tylenol harmful when I'm pregnant? Is it harmful to my child now?
yes.
Do I let my child go to brick and mortar school? Do I keep them home so they don't have to vaccinate? There's so many questions out there. And I don't think there's great resources for parents to be heard and their concerns to be heard. Yes, there's great resources out there. The AAP will tell you all the things that they should
Hmm.
tell you. And yes, you can read them and digest them. But there's no real place for parents to go and ask questions specific to their child, specific to their situation, or even just hear out their concerns. They don't even trust enough to go to their own pediatricians to ask, because all they're going to hear back, or that they think they're going to hear back, is you must do this, you must do that, and I don't want to hear from you otherwise. I do work with pediatricians every day who feel like they are trying to combat those fears. And
Yeah.
I just would really hope that there would be a better way for parents to be heard and pediatricians to be heard on an even playing field, where the parents can express their concerns and ask their questions, and pediatricians can understand and then express the correct advice where it's going to be heard by the parent and not confused with all the other things they're reading and hearing.
Mm. You bring up it's a really important point. You're right, because we're at a time where access to information and knowledge is so readily available. And I think what you're talking about is like the personalization of something as it pertains to a specific case is it's not always an apples to apples comparison. And like you
Yeah.
said, you have to look at the entirety of it, you being an osteopathic physician, looking at a whole entire thing. M- Maybe that is the lens that we want to say, hey, look, we're looking at this from the entirety, not just grabbing this from ChatGPT or Claude or whatever, the
Yeah.
latest LLM that you're using.
I would also, I'm a pipe dreamer, would love to at some point in this world have a place where families can access care in an easier way. for those who are in my generation. I grew up watching ER, which was a great Noah Wiley medical drama. Now he's in the
Yeah,
Pit, which is an equally great
yeah,
medical drama.
yeah. That's
He
right.
created something in ER called the Carter House, and it was always a dream of mine to do that. It's essentially a place where parents and children can take one single day off of school and work and not miss out on that finance that they need or the learning that they need. But in that one day, that they can all see the dentist, dad can see the internist, the child can see their pediatrician, the mom can see their OBGYN, everybody can do whatever testing they need because it's all in one building, all in one place, the lab, the radiology, the dentist, the social worker, whatever comes up in that day of care,
Hmm.
and it doesn't disrupt their day-to-day life more than in one day. I know for myself, I have one child, yet I feel like one day she has to go here and another day I have to go
Right,
there. I'm one
right.
of six kids. I can't even imagine what they went through when I was growing up. I would love for that to exist. It's a
Mm.
pipe dream and it's very, very far away, but it's definitely something I would love to see come to fruition somewhere.
Do you feel like with the advent of what's available virtually, that that's actually even now closer to a possibility than before?
Yeah,
I mean,
there's lots
I
of
do think
companies.
there's a time and place with brick and mortar, absolutely. And yet there's probably a large percentage of things that can probably be done remotely. And I don't want to take away from the in-person connection that you have
Yeah,
with a kiddo, with a parent. There's something that,
yeah,
it amplifies when you do things in real life. However, I think there's some adjunctive things that you can do
yeah.
that are very complementary,
I agree.
that don't
A
necessarily
lot.
detract from that.
Yeah, a lot of the social work out there, behavioral health, honestly, even just the patient care coordination side of it, right? Coordinating that care can all be done through AI enabled things, through virtual things, so that a parent doesn't have to take a day off to go see a social worker or to do the intake to then see the behavioral health therapist. Like there's so many steps that can be done virtually and AI enabled and with tech to reduce the burden both on the people providing the care and the people receiving the care. And I see so many companies really working to optimize care and close those gaps and create that access utilizing the tech that's out there now or the
Mm.
tech that can be created.
How much of this is really around education to parents? And if you could give every parent in America, like just a very simple rule, about when to truly worry about their kiddo's health, like what would it be?
So it's funny. My sister has a 1 year old, and the advice I gave to her at the very beginning, she's very chill about being a mom, was I parented like I am on an airplane. If the stewardess isn't panicking, neither am I. And so I said to her, if your pediatrician isn't panicking, then you shouldn't. With
Hmm.
that being said, I want pediatricians to be trusted and I want parents' guts to be trusted.
Mm.
That would be my two big things. I think that pediatricians are really good at listening to parents, and I think parents are really good at listening to their pediatricians. And I think both end up hearing all of the talk and the chatter outside. And so sometimes it can jade the productive conversations they can have.
Interesting. I mean, we were talking about this off camera, but I'd be remiss if I didn't bring it up. The 777 rule.
Yeah.
How do you think that applies in this particular case? And for those that don't know it, share with them what that means.
The 777 rule in our house is 7 minutes when we wake up in the morning. We talk about what we'd like our day to look like, the good things, the bad things, the hard things, the easy things, whether that's tackling something for school, personal, anything. 7 minutes once our school day is over to know where did we struggle, where did we have wins, how do we feel about all of it, and then the 7 minutes before bed to focus on all the good things and all the things we're thankful for, so that we can go to sleep mentally and bodily regulated to get that good restorative rest that everybody needs, especially when you're a growing kid. So we do that in our household, and I think it's really important if we could apply some of that to our medical care for our children. That even if you did less, right? 2 minutes, 2 minutes, 2 minutes, 2 minutes
Hmm.
for a parent to give you their thoughts about their child, 2 minutes for the pediatrician to give their expertise to the parent, and then 2 minutes to collaborate and really discuss family centrically what the plan is going to be. I did a
Mm.
residency program where we did family centric rounds. So instead of just the medical team rounding, we
Hmm.
stopped at every room. and the family, the parent, the child who's involved in that conversation. Obviously, children were removed from anything that would be above their
Right.
heads, if you will, but it was
Right.
really
Mm.
important for us to get that feedback from the nurse, the social worker, the nutritionist, the dietitian, the parent, the child, the doctor, the resident, you name it, just everybody. And I really feel like 2 minutes from the parent who knows their child, 2 minutes from the doctor who knows medicine, and then 2 minutes to collaborate. That collaboration can come to a good conclusion. It's a win.
Brilliant. And we talked about this also. It's like running a company is hard. And there's a lot of things that come at you that you're trying to be proactive, but you also are reactionary. When when things get really hard, when things get difficult, um, in a company, what kind of leader do you try to be for your team?
I am a roll my sleeves up kind of leader. If things are getting hard on the clinical side, I'm there to help triage, help determine if somebody needs to go somewhere, determine if workflows or protocols aren't working optimally to ensure that that care is given as efficiently and well as possible. I'm also a person who is analytical. So I will break things down and work with the financial side and the business side to say, this isn't working, but is there a way to do this differently without breaking the
Right.
bank, without compromising care, but ensuring that it's scalable?
Hmm.
Um, I truly believe in compassion. You want to make sure that your staff can see that you're a human and that you see them as a human too. We don't want to make people robots, especially in pediatric
Yeah.
medical care. Robots are not here to treat pediatric patients, and they're not here to talk to parents about any of that either.
Let's just let's say we fast forwarded 10 years from now and we did this conversation again and it's now 2036. And let's just say, pediatric care delivery vastly, vastly improved. What happened?
Payers got on the same page as pediatricians and reimburse them in the ways that they are entitled and should be. It's very hard to improve access when payers are not reimbursing the pediatricians in the manner that they should, specifically in the Medicaid community, but everywhere.
Mm,
It's really, really hard to talk to Medicaid patients who essentially just the emergency room is their only option.
yeah.
We're trying to reduce that mindset and say, hey, it's not, we're here. But then when the payers don't want to reimburse, that's free care given away. And so that's financially not sustainable for pediatricians, especially small practice pediatricians. I
Mm,
will scream from the rooftop, reimbursement rates need to get better for the pediatricians, or we're just going to create a generation of really sick adults.
mm. That is
Preventative
a
care starts with our little people, for sure. Mental
totally.
health, obesity, asthma, all starts when they're really, really little.
Mm. How do people follow the work that you're doing at Hello Pediatrics? Like, give us a bit of a commercial, give us a snapshot, and then we'll kind of get into our last question.
Love it. And we're on Instagram, we're on Facebook, and we're on LinkedIn. Primarily, we're working directly with pediatricians and pediatric practices, hospitals, mega groups, IPs, ACOs to partner directly with the pediatricians. But if a parent finds us on Facebook, on Instagram, even on
Mhm.
LinkedIn, and they think that service would be beneficial, we would love for those parents to try us out and then go back to their pediatrician and say, look what I did. This would be
Mhm.
awesome for the practice. And hopefully that will drive conversations with their pediatricians to say, hey, we're here to support you. Let's partner. We're ready to go. 50 states. Let's do
And last
it.
question is what gives you, I guess, the most hope about, the future of healthcare right now?
The people I work with wholeheartedly. This work is hard, right? Working in
Yeah,
healthcare
yeah,
right
yeah.
now is very hard. But I do get up every morning and I do go to bed every night knowing that I have an amazing team, both above me, parallel to me, and below me, working on a really mission driven company that is really working hard to change the ecosystem for healthcare when it comes to kids. And without that staff, we would be nowhere. These are people who grind every day to ensure Hello
Yeah.
Peds is providing really good care.
It's been awesome. I think one of the things, Shannon, that stood out for me is I guess your journey reflects a lot of the things that I see happening more and more in healthcare. People start their careers, focused on taking care of patients, and then they maybe not in all cases, but they realize that like, hey, look, if the system itself doesn't work, then even the best clinicians in the world are limited and they can only do so much. And you obviously stepped into medicine because you want to care for patients and kiddos. And along the way, you stepped into leadership, given that you're multifaceted and you seem like a builder. Like, you want to build something new. And that's not always an easy transition. And it just seems as though that you've made it look really easy. And it's not. Uh, However, I think those transitions are from clinicians going into these operating roles is something that healthcare desperately needs in order to kind of make that next sort of evolution. Um, so I've just really thoroughly enjoyed the conversation. So for those that if you're listening to this and there is a topic that you want to hear about or you want us to explore further, or even a leader that you want to hear from, drop a note, leave a comment. And if you don't mind, share this with people you care about, with your networks, with your communities. Like, this is a resource, this is a platform that is not just about content, in my opinion. It's really about community, and a community is an interactive, living, breathing thing. It's not just take, take, take. It's take, it's give, give, take, all those things. So, thank you for listening, and keep building with purpose. And we'll see you next time on the Advancing Healthcare Innovation Show.